We continue to follow the lawsuit filed by Planned Parenthood against a provision in the Big Beautiful Bill Act that revokes Medicaid funding for abortion clinics. A federal judge out of Boston, Indira Talwani, blocked the provision and directed the Department of Health and Human Services to ensure Medicaid funding continues to be dispersed to Planned Parenthood. A hearing on the case is set for July 18th. While taxpayer funding for abortion is argued on the federal level, we turn to how one state is using taxpayer dollars to promote family and life. A program called Mississippi Access to Maternal Assistance, or MAMA, helps connect pregnant women and new mothers to resources available in the state, from ultrasounds and prenatal care to food and baby supplies. The program supports mothers on multiple levels: access to food assistance and baby formula, health insurance and counseling, child support, and job training. It's a comprehensive system led by multiple state agencies to help mothers start off on the right foot and stay on a path of success. Mississippi Attorney General Lynn Fitch established the MAMA program. An iconic pro-life leader, Attorney General Fitch successfully defended a state law limiting abortion at 15 weeks in the Dobbs v. Jackson Women's Health Organization case that made its way to the U.S. Supreme Court. The historic win overturned Roe v. Wade and changed the legal landscape of abortion in the United States. I had the privilege of speaking with her about these programs and the current pro-life challenges facing our nation. How many women has the MAMA program helped since you launched it?
Well, thank you for having me today. It has been amazing. The MAMA program has very much served so many people across our state. To date, it's an app and it's also a website. The app has been amazing because so many women have reached out, looked at the app. So to date, we've had over 56,000 hits on the website and the app, serving 23,000 women in their particular needs, which is, again, incredible. What a God thing to have this available technology so that these women can have their needs serviced. That it might be childcare, it could be financial assistance, it could be, I just need a car seat. But here's the most important part about the MAMA program. It is comprised of public, private, and faith-based resources.
And was it always an app, or was that a recent iteration?
Well, we started out initially with a website, and we knew that most everyone has a phone and having that accessibility. So we created the MAMA app, just mama.ms.gov. And we see so many users, we see repeat users, and it's just been so accessible to mothers-to-be or young mothers.
It's incredible that you're meeting these women where they're at. Shifting gears a little bit, the One Big Beautiful Bill is establishing job requirements for safety net programs like Medicaid and the Supplemental Nutrition Assistance Program, or SNAP. How does this impact these programs on the state level, and are there plans already in place to manage this?
Well, we're very grateful for President Trump and his administration and being so thoughtful and having this bill, because it is very helpful. It's going to provide a great insight for the state of Mississippi. But in that regard, certainly with SNAP, nutrition, I think it's going to be incredibly important as we look at nutritional values for our children, for our families, for everyone across the state of Mississippi. But, on the work, I think that instills such great pride. We should be giving an empowerment to, a hand up, not just a handout. So I'm excited about that potential to add great value and self-confidence for individuals across our state,
which is so necessary for people's well-being. Now, I'm sure you've heard that a judge has blocked a provision in the Budget Reconciliation Act that revokes Medicaid funding for abortion clinics, at least until the hearing this Friday. Can you share your thoughts on the congressional move to block funding for a year from Planned Parenthood, as well as on the lawsuit?
Well, I think certainly the lawsuit, we've seen so many suits be brought against this administration to really try to impede our women to get into the opportunities that women have. And I think trying to go into this area is, again, quite the overreach. For Mississippi, we've had a moratorium here ever since the Dobbs case to disallow funding to be spent for Planned Parenthood.
That's incredible that you guys have been leading that charge. Now, Senator Josh Hawley of Missouri is talking about raising the minimum wage as a pro-family initiative. What are your thoughts on that?
Well, I think it certainly needs to be addressed and looked at, and a determination to be made. I think as we look at the numbers and the propensity of how would the value, how will it affect your low range, how will it help families, I think there's some amazing studies being done to determine where does that fall out, and again, how do we best serve those with a raise in our minimum wage.
Well, Madam Attorney General, it's been such a pleasure to have you here with us. Thank you for the work that you do.
Thank you.